On Health Matters Television for Life, when a tummy ache becomes a lot worse, it's time to call a doctor.
It took about a year before they figured it out.
A college student copes with celiac disease.
Celiacs can actually kill someone.
How changing her diet made a world of difference, plus answers to your questions on gastrointestinal illnesses. Right now on Health Matters.
Health Matters is made possible by our viewers, the friends of KSPS, and by Providence Healthcare.
Providence's motto is know me, care for me, ease my way. And Providence does that. I've seen it over and over again. I'm Dr. Stephen Murray, and I chose Providence because I believe in their mission statement. And working together with others of like mind is a very powerful way to take care of patients.
My name is Beth Perez, and I am a registered nurse, and I work at Holy Family Hospital on the labor and delivery unit. I'm about to have my second child, and I chose Providence because I love and trust the people that I work with, and why wouldn't I seek care from people that I love and trust?
Good evening, and thanks for joining us. I'm Teresa Lukens. Everyone gets a stomach ache from time to time, but when it's a sign of something more, then you need to seek help. Diagnosing the cause of abdominal pain can be difficult because many diseases can cause symptoms in your gut. Tonight, our panel discusses gastrointestinal disorders from irritable bowel syndrome to celiac disease, even acid reflux. So let's meet our panel. Dr. Lance Farron specializes in digestive health. He works at Rockwood Digestive Health Center. Dr. Harold Prikshitis is a gastroenterologist at Kootenai Clinic Gastroenterology and Endoscopy. And Allie Stanton is a registered dietitian at Providence Sacred Heart Medical Center. And thank you all for being here this evening. It's an important topic because really our stomach, and as we say, our gut is related to so many other diseases and the way our body works and how we function and our overall health. So let's start with Dr. Farron. And I actually want to start with Dr. Prikshitis and talk about when we become alarmed when that stomach ache might be something more, when we become concerned, or what we should be paying attention to.
Well, thanks, Teresa. That's an excellent question. I think the answer would include a consideration of what our pattern of stomach ache has been in the past. Everybody gets tummy aches from time to time, and if you have an extraordinary symptom onset, if the duration is out of what we're used to, if the severity is more extreme than what we're accustomed to, or if there are associated symptoms like nausea, vomiting, certainly diarrhea with bleeding would be symptoms that should cause one to suspect that this is not the usual sort of tummy ache that's going to disappear on its own.
And then we can be talking, as we mentioned, about everything from acid reflux to more serious diseases like celiac disease or Crohn's disease. Dr. Farron, when I pick up the phone and call my doctor to make that appointment, do I want to see you as a specialist then? Or do I go to my GP first? Where do I start the process?
Well, it's typical before seeing a gastroenterologist that you see your GP first. And he'll evaluate your symptoms, perhaps do some preliminary tests, and then refer you to a gastroenterologist if he's concerned or if he's just not able to answer your personal concerns. And then when you show up at the gastroenterologist, he'll have some basic lab work done, and that'll speed up the evaluation. Most of the patients that I see are patients referred specifically for evaluation of abdominal pain, because it is such a difficult thing to evaluate. There are lots of organs in the GI tract and lots of diseases that can affect each organ, and trying to and they seem to all cause pain in some people. And so figuring out exactly what the cause is can be quite a daunting task, but it's something that essentially we do for a living. Probably half my patients are referred for abdominal pain. Please figure out why it is.
Are you seeing more of it?
I think over the last 20 years we have been seeing more of it. We live in a very fast-paced life, and people are overwhelmed, I think, with the things happening in their life and with all the adrenaline in their system. And it seems like that adrenaline really takes it out on the GI tract. And so I think I do see a lot more of it now than I remember 10 or 20 years ago.
And that can be something like acid reflux, what is acid reflux?
Well, acid reflux is what many people understand to be heartburn, but for a lot of people it's not just heartburn. It can be chest pain, it can be manifest as difficulty swallowing, it can be a cough that won't stop, sore throat. There's a whole range of symptoms. And picking up on the point that was just made, I think one of the things that is driving the increase in not just gastrointestinal complaints, but a whole range of health problems is, of course, the obesity epidemic that we're seeing. And we certainly see a lot of patients who have symptoms that are related to that, reflux being one of them.
And Allie, that's where you come in as a dietitian, because a lot of that, especially with something like acid reflux and taking the weight off and controlling the diet, can really come into play.
Absolutely, and a lot of people just need to lose a little bit of weight and they'll actually see a huge improvement in their reflux signs and symptoms. But also just maintaining a healthy weight helps with a whole bunch of other health problems across the board. So it's really important that people are maintaining a healthy weight as just part of a healthy lifestyle.
When you sit down with a patient who is diagnosed with something like acid reflux, what are some of the foods that you'd like to see them start eating or maybe eliminate from their diet?
Some of the common culprits we always talk about are spicy foods. That seems to be a problem for some people. Chocolate can be a problem, caffeine, carbonated beverages. Those are all things we will ask the patient about and kind of try to find out if those things, if they can figure out if that's a trigger for them. As far as things that can help, smaller meals, eating smaller, more frequent meals can sometimes help with reflux. And also just kind of individualizing what works for you. I mean, we have some handouts and tools, but what works for one person doesn't always work for the next person. So trying to just get them on a healthy diet and appropriate weight and working with that patient individually.
So working with your doctor and your dietitian can really come into play. And there's some great over-the-counter products too now that can treat acid reflux or heartburn as we know it. And some things that used to be prescribed that are now over-the-counter.
Omeprazole, Prilosec and Prevacid are proton pump inhibitors. And over the counter, they're just as good as anything that we can prescribe.
All right, let's go on to some of the other things we're talking about. Irritable bowel syndrome, IBS, has become sort of a buzz play, and that can be anything from being extremely constipated to having bouts of diarrhea. Describe what happens with IBS.
Or alternating. There are some patients, in fact, the most difficult patients to help are the ones that sometimes will go from being constipated to having severe bouts of diarrhea. I think one of the interesting things that's come up in this whole area is the relationship of gluten. We've always known that gluten was the culprit in causing celiac disease, but a lot of people are now finding that eliminating certain types of foods from their diet is helping quite a lot with irritable bowel syndrome. And one of the new acronyms that's been put forward is something called FODMAPs, which stands for fermentable, oligo, di, mono, and polyols. I hope I got that right. But it turns out that eliminating these sorts of sugars from your diet are very helpful in some people with irritable bowel syndrome, and might be one of the things that happens when you actually eliminate gluten from your diet, is you're, by the way, eliminating a lot of these other components that trigger symptoms.
Well, which leads us into that discussion about celiac disease and the other hot topic being going on gluten-free diets. And what is celiac disease?
It's a type of allergic reaction to a protein found in wheat and related grains. It occurs in about 1 in 100 people. It's not probably any more common now than it has been 100 years ago, but we have good tests for it now. And doctors are very clued into taking it or into evaluating for it. A simple blood test is really very good at establishing.
There is a blood test now.
There is a blood test, and it's called tissue transglutaminase. And it's a very accurate test. It's 90% accurate in saying whether you do or whether you do not have celiac disease. The best test is to get a little sample of the small bowel that we do with endoscopy, but a TTG is a great screening test.
All right, I want to talk more about diet and celiac disease and going gluten-free with Allie, but first, the next time you go to a restaurant, you might notice that on the menu there are a lot of gluten-free items. So you might just see the words gluten-free also at the grocery store and at those restaurants, becoming easier to find all the time. But gluten-free is more than a trend, and for some people, celiac disease means food that won't make them sick.
Holly Frazier is a typical college student, but there is one college staple she can't have.
I really miss pizza.
Holly has celiac disease.
It's just kind of like an acidic feeling that's kind of always there. It doesn't actually ever really go away for me.
This autoimmune disorder means that Holly gets sick when she eats food with gluten, found in wheat, barley, and rye.
It's kind of like a boiling feeling in my intestines when I actually eat gluten, and it's awful.
It also makes her tired. At times, Holly can barely get out of bed.
It's very exhausting, actually, and it takes about 2 to 3 days for it to go away.
Those days are behind her now that Holly knows why she gets so sick.
It took about a year before they figured it out.
But keeping healthy means keeping a close eye on what she eats.
It definitely does make my life difficult just because I'm a college student, and it's way easier to buy top ramen and mac and cheese.
More and more places like Spokane's main market are making it easier for Holly to shop, providing customers with a variety of gluten-free options. Even restaurants are getting into the gluten-free game.
It's nice. It makes it easier for me to go out with my friends.
For Holly, going gluten-free will always be a part of her life. And for those who think it's a fad, she has this to say.
It's definitely a real disease, and it really bothers me when people think that it's not a big deal, because it isn't. It's an autoimmune disease. It's like rheumatoid arthritis.
It sounds like Holly hears that a lot. Well, yeah, people roll their eyes, you don't really have a disease, you go gluten-free, it's sort of the trend now, but indeed it can be quite serious.
There are a lot of people who are very debilitated from celiac disease if they haven't been diagnosed or treated.
How important is diet when it comes to celiac?
Diet is 100% of the treatment when it comes to celiac, so it's absolutely essential that you go gluten-free. And that doesn't just mean cutting out wheat and bread, but a lot of condiments and products have gluten in them too, things like soy sauce, salad dressing, lunch meats. So you really have to scrutinize food labels and do your research when it comes to what you're eating. But there's no cheat days when it comes to being gluten-free if you have celiac. It's a 100% of the time.
So as a dietitian, you're probably very happy to see all of the products that are coming out and the restaurants offering those choices?
Absolutely. For someone that has celiac disease, it is a huge lifestyle change, and it's really nice for them to have more options as far as what to eat when they're going out and when they're grocery shopping. A lot of people in the public are also trying gluten-free diets for whatever reason, but for people with celiac disease, it's like a medicine for them. They have to have a gluten-free diet in order to treat their disease.
Can I feel better going gluten-free if I don't have a celiac disease or the allergy?
Some people say they feel better going gluten-free, and if you feel better, I say, okay, that's fine, but I also like to ask people why they feel better. What are you taking out of your diet that is making you feel better? Are you taking out cookies and refined carbohydrates and replacing them with fruits and vegetables? Well, that's pretty much a given that you're going to feel better. And also, not every gluten-free product is a healthy alternative. A lot of them are low in fiber, vitamins, minerals, because they're not made with whole grains. So it's not always healthy. They make gluten-free cookies, they make gluten-free cake, and that's something that we should all eat in moderation, regardless of gluten or not.
I think there's a cautionary tale here that, although it's become a lot easier for the celiac patient to find gluten-free alternatives because it's become such a trend, there is a danger of going on a gluten-free diet because of the implications that might have. I mean, it can be socially isolating, it limits your options, even though we have a lot more available. I think this is particularly important for children, for instance. No pizza for you. It's really not a trivial change to make in your diet, which is why some people, while they take out gluten, may actually feel better because of some of the other things that come out with the gluten. It also underscores the importance of getting an accurate diagnosis, and that diagnosis is better made in the true celiac patient while they're still getting gluten. So having patients come to us who've been on a gluten-free diet and wondering whether they have celiac disease makes it somewhat challenging, and we sometimes have to ask them to return to a gluten-containing diet for a while to make that diagnosis.
You're going to need to feel crummy for a little while before
Unfortunately.
we can,
And it does have other implications as well, bone health, reproductive health. We now recommend that people who have celiac disease, proven diagnosis, all their first-degree relatives should be screened for celiac disease as well, because we have now become aware that there is a large range of manifestations of celiac disease that are no longer, we used to think of as just the young child with diarrhea who's not growing. We now see it in the entire age spectrum and manifesting in many different ways.
Well, that's very interesting. Go ahead, Allie.
I work primarily in pediatrics, so we always recommend the whole family get tested, just as we were saying. But also, we do recommend that the household stay gluten-free for people that have children with celiac disease, because you don't know what your kids are going to get into. And cross-contamination in the home can be a concern as well. So we kind of encourage parents to eat what you choose when you're outside of the home without your child, but make the household gluten-free. And that can be a big challenge for people.
Yeah, especially a big change for families too. And we are encouraging your phone calls this evening and emails. And we have Ryan calling in from Spokane this evening. Hello, Ryan.
Hi there.
You have a question for our panel?
Yeah, sorry. I have a 4-year-old with cerebral palsy who gets very constipated, and we do daily Miralax, Senna, children's X-Lax. Is there any type of regimen that would be better for him to be more regular?
Okay, excellent question, Ryan. Ryan, are you still there?
I am.
What kind of a diet do you have your little guy on?
He's eating normal,
what
we
4-year-olds eat,
pretty much. Well, yeah, they have the same dinner we have, and chicken, rice, is what we're eating right now. So.
Okay,
but
thank you so much.
Yogurts, things like that.
All right. That's a tough one.
I'm not a pediatric gastroenterologist. I'm an adult one, and there may be a big difference. I know in an adult, the fundamental principle that I'd offer to Ryan is that his child should have, his child's colon should see the same thing every day. So try to get into a regular routine. And in my patients with constipation, fiber is the key component. You want to make sure you're getting plenty of fiber. And if it's hard to get to the store, take a fiber supplement that's easy every day. And then you can add Miralax on top of that, which is a chemical that mixes in with stool and keeps it soft.
But are there any concerns getting him on that and then being dependent upon that?
Not with fiber or with Miralax. There are with stimulant laxatives such as X-Lax. Those people can develop a dependence, and it can weaken your colon long term. But there really wouldn't be long-term side effects with the Miralax or with fiber. And then there are additional, we have 2 additional prescription medications we can use, but I don't know if they're used in children or not.
Allie?
Something in the peds world that we recommend are fruits that are high in sorbitol. So those are prunes, pears, peaches, plums, kind of the ones that start with a P. And what the sorbitol does is it softens the stool, so it makes it easier for the child to pass the stool. Sometimes what we find is children are actually kind of holding on to the stool because it's uncomfortable for them to pass it, and then it gets harder and is more uncomfortable and kind of creates a continual problem. So in the peds GI clinics, we recommend 3 to 5 servings of those high sorbitol fruits a day as best you can.
Would his cerebral palsy have anything to do with staying regulated that way, or is that related at all?
I think I'm not a pediatric gastroenterologist either, but there's such a large manifestation of cerebral palsy, I think that it would be difficult to say. But one point I'd like to make is that I think one of the keys to treating constipation at any age is having that regular program. And what some people do is they are afraid of laxatives because they're concerned that they might be habit forming and so on. So they'll wait until they're really uncomfortably constipated and then do the big clean out, so to speak. And making that sort of a cycle is not probably a good way to enjoy your lifestyle, certainly. And so I encourage my patients to use safe laxatives such as fiber supplement, osmotic laxatives primarily, and to do it on a regular basis, and then reserve the more stimulant type of laxatives for what I call the rescue laxative. Okay, if you haven't had an adequate bowel movement in 3 or 4 days, then use the rescue laxative, but then return to that regular program.
How important is it to our overall health to stay regular? To go once a day, twice a day? How often should we be having a bowel movement to keep our overall health in check?
Well, people vary a lot, and the normal range for bowel movements is from 3 times a day to 1 every 3 days. And if you're going outside that range, probably should be evaluated to make sure that something else isn't going on.
All right, let's take another phone call this evening from Linda in Lewiston. Good evening, Linda.
Hi, how are you doing?
Very well.
I'm calling about my 31-year-old daughter. She has struggled with the symptoms that you guys are describing since she was 18. They took her gallbladder out. She's been tested for IBS. She's been tested for Celiac disease. They've done everything. She is a mom of 3. She has days she literally cannot function. She did the blood test for the wheat, the glucose or whatever. They said she's not allergic to it. They put her on a medication. She takes a half a tablet a day, and she can't function. It puts her instantly to sleep. But she cannot get any answers of what is going on with her.
Linda, besides the fatigue, what other symptoms does she have?
The extreme pain, the burning, severe diarrhea, to where she'll pass out. And then she'll get constipated. She has cut out all the sugars. She has cut out all the wheat products. Nothing is working. She's had the colonoscopy. They've done I don't know what it is, the test. They put the tube down her throat. They've done everything.
Wow, that sounds like a challenging case. Any thoughts toward what Linda's daughter might be going through?
Well, it certainly sounds like a challenging case, and unfortunately it's not that atypical to see patients who really over time develop very intractable and severe abdominal symptoms. One point I'd like to make is that there are no specific tests to diagnose irritable bowel syndrome. It's a clinical diagnosis, and I think in some circumstances it's reasonable to look for other conditions that might be causing those symptoms, but there may not be there is not a specific test that we can do and say, this is irritable bowel syndrome. The diagnosis is based on the absence of other conditions and particular manifestation, abdominal pain, diarrhea alternating with constipation. It certainly sounds like difficult irritable bowel syndrome.
So she probably just needs to seek more medical advice?
Well, irritable bowel syndrome, even though some people, including physicians, use it as kind of a basket to hold patients in, it can really ruin somebody's life. They took 100 IBS patients and asked them to rank their life and their pain. And they took 100 patients with metastatic pancreatic cancer. And the people with IBS had a worse life and more pain than the people with pancreatic cancer. It can really ruin your life. Our goal is, when I see someone like this in my office, and it sounds like she has good doctors taking care of her, they've been very thorough, but when I see somebody like this, my goal is make their life more manageable. And the way I do that is, a moderate diet with lots of fiber in it, a fiber supplement. Regular exercise is really key. Limit stress in your life to the extent you can, and get plenty of sleep. And that's probably going to be the best you're going to be able to do.
And change your diet.
And she may want to look into the low FODMAP diet that Dr. P was speaking about earlier. That is a newer thing that not as many people are familiar with, and it's not just avoiding wheat, but there's other fruits on the list and things that she maybe hasn't heard of avoiding as well.
Where is a good place, Allie, for her to seek that information? Is there information online that she can find out more about that?
There is, definitely. I've seen some out of Stanford University, and I believe a lot of it has come from Australia, is where more of the studies are from.
Monash University in Australia, that's right.
Yeah, worth an internet check on that one.
For sure.
Let's take another phone call. Rolf in Spokane, good evening.
Hello.
You have a question for our panel this evening?
Well, yeah, actually, I just want to comment about the subject of gluten. I have a daughter that has some special needs, and she is also gluten intolerant from the time she...
Did we lose? Okay, Rolf, if you're listening, please go ahead and call the phone number back. We'll be happy to take your phone call tonight and get your question into our panel. In the meantime, let's talk about a few more things, including lactose intolerance. This sort of fits in with the trend of gluten-free, I guess, but a few years ago it became kind of the phrase we were hearing a lot, and there were milk and all kinds of dairy products that were coming into play that were lactose-free. What is this lactose intolerance, and how can that affect my health?
Well, it's actually the same pathophysiology that plays into lactose intolerance that we've been talking about. Basically, our small intestine is the part of our gastrointestinal tract where we absorb a lot of these sugars, and what we've come to realize is that our efficiency in absorbing these various sugars, including lactose, varies from individual to individual, and also varies depending on what sugars you ingest. And certain people lose the ability as they age to digest lactose. The lactose, or any poorly digested sugar, goes through to the large intestine, which is inhabited by bacteria, which are there as part of our normal physiology. And those bacteria feast on the lactose, basically, and turn it into gas and small particles, which we call osmoles, and that can result in bloating and flatulence and diarrhea or symptoms of irritable bowel syndrome. Other sugars that we became aware of, fructose, for instance, is a common fruit sugar, and that has now been superseded by the fact that we recognize a lot of these things, hence the FODMAPs, can be absorbed poorly and can cause symptoms in some patients.
So that's so interesting. And again, that comes down to diet and cutting out a lot of dairy products, unfortunately, but there are products on the market that you can substitute with.
There certainly are, and a lot of people can tolerate a small amount of lactose, and if you keep that small amount in your diet, sometimes you can build up your tolerance. Also, certain dairy products like yogurt, cheese, ice cream are a lot lower in lactose than milk. So some people can not drink cow's milk, but they can have the other dairy products. And again, it kind of is based on a person's sensitivity and tolerance too. But if you need to avoid it, there's certainly a lot of alternative products out there nowadays.
All right, we have another phone call. Diane calling from Spokane. Hello, Diane.
Hi. For the last 2 years, I have had bouts of intestinal pain. It doesn't happen all the time, just every so often, and it doubles me up. But I don't have the diarrhea or constipation. I have normal bowel movements, and I have done a lot of research online for all the different intestinal maladies, and I could never figure out why I didn't have some of these things. My dad had colitis real bad, and I remember when I was a kid he used to suffer with that.
Can you relate it, Diane, to anything you've eaten or a certain time of day, something else that might be helpful information?
I'm a pretty natural type of person, and I watch my diet, and I really have never related it to anything. It just hits me. But what I could never figure out is why I never had the diarrhea or the constipation, because that seems to be the thing that goes with all these intestinal problems.
And it's a stabbing pain that sort of hits you out of nowhere.
Oh, yeah. And it lasts for about a week.
Oh, really? That long? So it's not short term.
And then it just goes away.
Okay. Any advice for Diane this evening?
Well, I guess she can be happy that it goes away.
It does go away.
I think.
But how concerned should she be too if it's lasting for a week at a time?
Well, but she's had it for 2 years, and so in terms of concern, this is not likely to be something that's progressive, or I'm sure it's a big nuisance for her, and but probably not indicative of more worrisome underlying pathology. One would hope that she'd been checked out carefully by a gastroenterologist, or at least by her internist. I think part of what we're seeing here with complaints of this type is it's a bigger basket than what we were talking about. And the basket includes irritable bowel syndrome, but a whole group of disorders that we call functional gastrointestinal disorders, which means that we recognize that it is a problem, that there are symptoms associated, pain or what have you, but we can't find the specific piece that has to be removed or a specific medicine that has to be necessarily given to find the cure for that. It might just be part of normal physiological function that is perceived as being painful by some people for various reasons.
Well, as I was doing my research for tonight's topic, I was finding things like thyroid disease associated with things that can be going on in your stomach and your abdomen, and all these different related, how important it is to, for our guts to be healthy. And another thing I've been fascinated with lately is the probiotics. And the fact that we're seeing now a lot of products for probiotics and keeping our gut healthy. Allie, I eat yogurt every day. Am I getting my probiotics, or do I need to buy a specific yogurt to get that?
I don't know.
And what do they do?
So they're kind of the good bacteria. They help the good bacteria, or they have the good quality bacteria. So if you have an infection, or sometimes if in the hospital a patient has diarrhea, we'll give them some of the good bacteria to help kind of calm the diarrhea. So if you're eating yogurt, you're getting some of them. Whether you're getting enough, I'm not always sure. But if you feel good and your GI function is normal, you probably don't need to go overdosing on them. But they do have a function out there for certain populations.
Okay. Let's take a phone call from Susan in Spokane. Good evening, Susan.
Hi, I'm calling in regards to, I have a friend who has a bowel movement maybe once a week, and this has been going on for years, and they have never diagnosed anything.
She has a regular diet, and she doesn't seem to have any associated symptoms with that?
No, exercises regular, eats a good diet, and just never, ever wants to go before that. And then it's a big one that is not healthy.
Okay, well, again, our systems are different, but once a week, is that?
That's outside the norm. And I'm glad she's had a colonoscopy at least, and hopefully she's had her thyroid looked at. There are a couple of things that I would immediately do when someone like that came into my office.
And what
I guess it depends in part on whether she's troubled by it. It sounds like perhaps her friend is more troubled by it than maybe the patient is.
It could be. It's a little cause for concern, I guess. All right, let's touch on a few other things we're talking about when we talk about tummy trouble. We've talked about celiac disease, but what about colitis, which can be a fairly serious condition also?
Well, colitis is a very broad term. What it specifically means is inflammation of the colon. And there are many things that can cause inflammation of the colon: acute infection and more chronic disorders such as ulcerative colitis or Crohn's disease. What makes the term colitis more confusing is irritable bowel syndrome used to be referred to as colitis, and it was a term that's been used to describe a lot of intestinal disorders. So it's really a very vague term. To be more precise about it, I mean, the worrisome type of colitis would be inflammatory bowel disease, mainly ulcerative colitis and Crohn's disease. Infectious colitis certainly can happen. C. difficile colitis, for instance, is a big concern. It was a concern in hospitalized patients, but we're seeing more and more of it in the community. And then there are forms of what we call microscopic colitis, which can result in diarrhea and problems that are helped by a specific diagnosis and treatment.
All right. We have an email to address this evening, and this person is asking, please address the difference between food intolerance and food allergy. It's an excellent question. Allie, would you like to take that?
They can probably give you a more scientific diagnosis than I can, but if you have a food allergy, it's your body has a true reaction to the protein in that food. And if you have a true food allergy, you should have 100% avoidance of that food. Whereas a food intolerance, it's more like Dr. P talked about, signs and symptoms maybe of bloating, abdominal distension, discomfort, such as with the lactose intolerance, but you can actually digest some of that food. So some people will say they have lactose intolerance and they can still tolerate some small quantities of milk, but if you have a true milk allergy, you're allergic to the protein and you couldn't tolerate any milk.
You would become quite sick.
Or cheese, dairy products, that what at all, yes.
That's an excellent description.
If you guys want to
do you want to piggyback on that?
I agree 100% that food allergies are truly dangerous things. Peanut allergy, for instance, can be life-threatening, as can other food allergies. A food intolerance, for instance, lactose intolerance, it might make you miserable, but it's not going to shorten your life or cause major problems for you. You'll get over that bout, and then, you know, next time you want to treat yourself to ice cream, you'll pay the consequences. But it's not as, doesn't have the dire consequences that a true food allergy does have.
And you'll probably sort of discover if you have an intolerance, if you just don't feel well after you eat a certain group of foods, or.
Yeah, typically for intolerances, other than maybe lactose intolerance, there's not a lot of testing that you can always do, but food allergies you can certainly do testing for to figure out if you have a true allergy.
Okay, let's take another phone call this evening from Sharon. Hi, Sharon in Spokane.
Hi, how's everyone there?
We're great. You have a question?
I do, and it's kind of a two-part question. About 2.5 years ago, I was diagnosed with colonic inertia. I was wanting to find out more about it, like what the cause is. Is it due to hereditary influences? I do take Miralax every day, and it is working, but I'm worried that at some point it will stop working. Is that going to be a problem for me?
Dr. Farron?
Colonic inertia means that the colon's slow. And there can be a number of reasons for that. There can be a neurologic condition, and generally those people have had slow colons since birth. The colon generally slows down as we get older, and she might have been born with a colon that was a little bit slower than average, and it might be slowing down more since then. Hypothyroidism can cause a slow colon. I suppose probably the biggest category are just idiopathic slow colons. She'll always be better off with Miralax than without it, but in 20 years, if her colon slows down more, she may need additional medications to take on top of that.
And she was concerned that it could stop working at some point. Is that something she should be worried about?
No, Miralax is a chemical that mixes in with the stool. It's not absorbed, and it just keeps the stool from getting hard.
And the other thing she was curious about was it hereditary?
There are some types of colonic inertia that can be hereditary.
So should her children, other family members be concerned about that, or at least keep an eye out for it?
They'll, you know, if they don't have a bowel movement for a week, people are always aware of that. And it might be a little bit more likely, but it's the sort of thing, if the problem comes up, deal with it, then you wouldn't have to do anything proactively to look out for that.
Okay, very good. You know, we talked about a contributor to some of these issues being stress, and that's where we're seeing more ulcers too. What is an ulcer, and how is it treated, and are we seeing more of them?
Well, I presume we're talking about peptic ulcer disease, because ulcers can occur any place in the intestine. And one of the things that we've learned over the last decade or more is that stress probably isn't such a big factor as one would think in terms of causing ulcers. In fact, most ulcers are caused by the presence of a bacteria in the stomach called Helicobacter pylori, which can be checked for and treated if it's found to be present, and should be treated because it's considered to be one of the main risk factors for the development of gastric cancer. The other big cause of peptic ulcer disease is the use of aspirin and NSAID drugs, ibuprofen, Motrin, Aleve, Advil.
And we see those warning labels now.
We do, and we certainly see a lot of patients who come in with complications of ulcer disease, especially bleeding, who have been taking NSAID drugs, sometimes taking them on top of other NSAID drugs. For instance, they might be on a prescribed NSAID and not knowingly take Advil or Aleve in addition to that, which really can get you into major trouble with peptic ulcer disease and complications.
Can letting something like acid reflux lead to an ulcer? Letting something like that go for too long?
Well,
or are they two unrelated issues?
Well, they're really different diseases. They have the acid component is part of both of them, but most reflux disease, gastroesophageal reflux disease, has to do with acid being in the wrong place. Peptic ulcer disease has to do with loss of the ability of the stomach or the duodenum typically to protect itself, which it naturally does from the acid that's present normally in our GI tracts. Fortunately, we have great medications to treat these things now, and one of the important things is avoidance of NSAIDs, especially if you're at risk.
All right. We have Sue calling from Newport. Hello, Sue.
Hi. I have a question about irritable bowel syndrome, Crohn's disease, and I'm diabetic, and I lost my grandfather to cancer of the bowel.
And you're concerned that that could be something that you're going to suffer with, Sue?
Well, I think I have the irritable bowel syndrome right now. I am going to see my doctor next week about it.
Okay. Again, there's some cancer in the family. Should she be concerned considering she believes she has irritable bowel syndrome?
Well, I think we all need to be concerned about the health of our colon. As a gastroenterologist, I save more lives with a colonoscope than I do anything else everything else that I do combined. And it's, Colon Cancer Awareness Month. Want to make that known to your viewers. And her issues would be, totally clarified by a colonoscopy.
90% treatable and 90% preventable. Am I right in saying that? I think I just read that somewhere. If you're diagnosed,
if you look at the data a certain way, I think you could support those numbers.
Okay, very good. So another good thing to keep an eye out and good reminder to get our colonoscopies this month, in the month of March. All right, we have an email we want to address. I hear the benefits and warnings of cleanses. This is a great topic. What are the doctor's professional opinions on short-term and long-term effects of cleanses? Are they safe? This is coming in from Sam. This is something I wanted to address, so thank you so much, Sam. We're hearing juice cleanse. We're hearing any number of different cleanses. What's your take?
I wish I knew the answer. What I can tell you is that the whole issue of what we call the human microbiome, those are those bacteria that live within us and around us that we're finding are important to keep us healthy. We're starting to understand how that works. We're also starting to understand that not all microbiomes are equal, and by changing a person's microbiome, you may improve their health or change their health. I have not seen a rash of patients who've come to see me with problems because they've been going through cleanses. And I think there's a lot about that manipulation of the GI tract that we don't understand yet, but we should have more information about it down the road. But I have not seen any major problems associated with that in my practice.
And we've heard about people doing cleanses for any number of reasons, to lose weight, or some people say that it can actually remove toxins from your system, those sort of things. Is there anything to substantiate that? I mean, obviously you're going to lose weight if you're just doing a juice cleanse for a few days.
I have people ask me about doing cleanses, and it's primarily for weight loss. Some people say they want to get healthier, and I do remind them that we have a liver, and that does naturally cleanse our body and filter out toxins. But for the most part, it's not a good way to lose weight, because what you're going to lose is very short term, and as soon as you start eating a regular diet again, you're going to gain it back. So I don't encourage them for most people for weight loss. They're not usually nutritionally complete either, but for the normal healthy person, if they do one for 2 to 3 days, they shouldn't have any long-term health consequences from that.
Okay. We have Al with a phone call this evening. Hello, Al.
Hi. Hey, don't laugh at the question, but as I'm getting older and I look back at the activities of young children and young adults, there's a lot of somersaults. There's a lot of walking on your hands, standing on your head. Have there been any studies related to, hey, maybe these little kids have really got something there? As I'm getting older and look at my peers, I see all sorts of internal problems. And I'm just wondering, hey, maybe there should be some kind of a therapy where you can go in and hang upside down for a while or whatever. If you could help me with that question, I'd appreciate it.
All right, Al, thank you so much. Nothing off the table tonight, Al. There are actually some products now that people are purchasing to do the inversion, to hang upside down. Can it help our overall health or intestinal?
Well, I certainly wouldn't recommend it for anyone who suffers from gastroesophageal reflux disease because that...
It's a wrong way to go.
that is going to be a catastrophe. But I thought we were going to hear about kids being more active to improve their physical well-being and cut down on pediatric, children and the obesity problems. But I don't think that hanging in a particular position is going to have beneficial impact on your intestine.
Okay. It's not moving things around. It's not sort of repurposing your organs or anything like that when you hang upside down.
Yeah, reminds me, I had a friend who was a cardiologist that wanted to try out for the space program and did try out for it. And he would always ask our professors in medical school how a system would function under zero gravity, and it always kind of threw the professor for a loop, as it is kind of now. But I'm not aware the astronauts really had to do anything special to take care of their GI tract, nor did they suffer any ill consequences of it.
So maybe Al is just going through what we all go through in the aging process, and hanging upside down might not help that. Well, let's go around and just get some last thoughts on keeping our guts healthy and overall health when it comes to our digestive system. Allie, what would you recommend overall?
I think one of the most important things people can do for their overall GI health is maintain a healthy weight and minimize your intake of processed foods. I think processed foods really, for the most part, aren't healthy for a lot of people. They have a lot of hidden ingredients in them. And if you eat more fresh produce, lean meats, dairy products, whole grains that are natural, if you can tolerate them, I think most of us would be a lot healthier and avoid those inner aisles of the grocery store where all the packaged processed foods are hidden with all the problems that they come with.
All right, Dr. Farron?
Well, what I often tell my patients is that the GI tract can really take a joke. I mean, you can put a pepperoni pizza in the GI tract and handle it fine. The part of your body that can't take a joke is your heart. So live a heart-healthy lifestyle. Don't eat too many calories. Eat a balanced diet. And if you smoke, stop smoking, because your GI tract will do fine. And by and large, people don't die of conditions of the GI tract compared to being hurt by heart conditions.
All right, and Dr. P, some final thoughts in the next few seconds here?
Colonoscopy. If you're age,
one word.
If you're age 50, have a colonoscopy or more, have a colonoscopy, whether you have symptoms or not, whether you have a family history or not.
All right.
If you're an African American, it should be age 45.
All right, very good. Great discussion this evening. I want to thank all of you for being here tonight. An excellent panel. Our thanks as well to everyone who called in with their questions and emailed. And when we come back, an update on the Affordable Care Act. Well, you have just 12 days left to sign up for health insurance under the Affordable Care Act. Open enrollment does end on March 31st. If you want coverage, but maybe you need some help, there are people locally right here in Spokane that can help you. Joining me now with more is Ray White with Community Minded Enterprises. He helps coordinate the In-Person Assisters program right here in Spokane. Ray, thanks so much for being here.
I'm happy to be here.
This is a big job, coordinating all the people that actually get on the phone or on the computer with people and help them sign up for their coverage. And it's been going quite well, but there's still a lot of people that have questions. And what kind of things are you hearing at this point?
Well, actually, excuse me, a lot of what we're hearing is that a lot of people really have not really been, responded to the advertising related to the act. And I think I saw a poll last week that something like 23% of all Americans are totally unaware that there even is an Affordable Care Act. So when you add that to another high percentage of people who kind of know what it is but don't really know if there's going to be any impact to them personally, then there's really a much smaller group of people, I think, that really are on top of what's going on and understand that not only the opportunities, but also understand that there are some tax penalties that unfortunately might be applied to people that don't have health insurance after March the 31st.
So when that date comes and goes, you're going to be penalized for it if you're not signed up.
Right, and it'll be a tax penalty on when you file your taxes during the next year. So.
What other kind of things are people kind of confused about, or what kind of questions are the in-person assisters hearing right now about signing up, the confusion maybe that's applied to it?
Well, I think people have been really good at once they know where the website is, at actually going there and taking a look. I think when the Health Benefit Exchange, that's the organization that runs the Washington's Exchange, when they put together the program, I think there was an assumption, well, maybe not only here but also nationally, that most people would be able to go onto the website and purchase the insurance very easily if you're used to going to the internet, for example, possibly buying airline tickets, reserving hotel rooms.
That analogy was used a few times with the airline tickets.
Right,
yeah.
and I'm in there quite a bit, and it's a little more difficult than that. It's sequential. I mean, it works very, very well, page to page to page, but it's built on some kind of a logic model that forces them to ask questions that will really take people by surprise. And if they answer a question wrong, sometimes it'll stop their process. And we get a lot of calls from people who've actually entered into the process and have been unable to go further. And a lot of times they will call the call center. There's a statewide call center, which happens to be located in Spokane. But the traffic there is much higher than they thought it would be as well. So people are experiencing longer wait times. So the advice I give people if they are referred by a friend, or if they call me or send me an email, is to try to find some help from one of the organizations. And there are many in Spokane. There's probably well over 100, maybe 150 in Spokane County alone, that have people that are in-person assisters, or navigators is another word for what we do. To have someone that can sit down with you and just guide you through the process.
And what kind of information, again, do they need to have when they sit down to start the process? Even if they're working with one of the in-person assisters, you do need some vital information that is going to need to be available so that you can get signed up.
Sure, and the first thing we need to do is we need to verify their identity. So what a person would need to do is to make sure they have their driver's license, make sure they have, if possible, a social security card. I know a lot of people don't carry them around, but it would, if at all possible, it would be a good thing to bring. We recommend that people bring copies of their last year's taxes, because you are required to estimate your income, and also to identify all the household members by not only name but also by social security number. So that's typically pretty conveniently located on your taxes, especially if you have children as dependents. So we ask people to bring those kinds of things. The Affordable Care Act is available not only to regular citizens, but also people who are here on a legal basis. So if people are here on certain types of visas, we would recommend that they might bring a copy of the visa, because sometimes the system will ask you to verify your statuses in a certain way, a social security number, a visa number, something like that. So we have the ability to actually, if we see those things, to actually upload them to the system and make their journey through the process easier.
What is the best way then to contact an in-person assister to get that help? You say when they come, is there a location they can actually physically go to, or set up an appointment to go to?
Well, actually there are many, and as I said earlier, we're one of many organizations in Spokane that do this work. I would recommend that they could start by calling our organization, and we have an appointment line number. It's 444-3066. And we also have a great primary partner with the Spokane County Library District, and it's not the city library, but the county. And they have 8 navigators on their staff that have been trained, and they've been signing up hundreds and hundreds of people. And their hotline number is 893-8400.
893-8400.
Right. And you also can go to the actual Health Plan Finder website, to the wahealthplanfinder.org, and there are places on there where you can actually access a list of navigators, not only throughout the state, actually. by name and zip code, organization.
Do you anticipate, Ray, that it will get quite busy in the next week?
Well, actually, it's been quite busy for a while. Because even though, as I stated earlier, a high percentage of people really don't know how this affects them or if it affects them, a lot of people do. And a lot of and word of mouth from people's earlier efforts is starting to drive people to not only ourselves, but most of the medical clinics have in town here have in-person assisters. The hospitals do. There's an organization called Better Health Together, which actually is the kind of the clearinghouse or the overall organization that we all report to and report through. There's just a number of different places that people can go. So it's not a lack of resources. I think that there's maybe not necessarily been a lack of information, but some people just haven't really looked in the right places to see the information that's out there about the resources that are available.
Of course, a lot of people anticipating that the young are still not signing up and may not sign up and just take the penalty and perhaps wait the next year and see how things go. It's just sort of hard to say what they're thinking, the young and healthy as they've been calling them.
Right, and one thing I would say to anyone who might be listening is that a lot of people are also unaware that the state of Washington chose to expand their Medicaid program. States had the option and Washington chose to do that. And what that means is that now you can actually have much more income and be eligible for absolutely free health insurance. And we worked with a number of young people, and particularly students, for example. And they may think, well, for example, if they know anything about Medicaid, not too long ago, you could only make just a few $100s a month and be eligible for Medicaid. But they've expanded that out to almost $16,000 a year. So a lot of minimum wage workers, a lot of college students who are working part-time, could now be eligible for that free health insurance. And it's good coverage. And it is health insurance, and it satisfies the mandate. So a lot of people don't know that either. And it's really something that's been really good in Washington State. I'd say that Washington State's experience, from what I just have observed, as usual, is always right on and very good related to health, but all social services. It seems like Washington's on the cutting edge.
And very good information and lots of help available. Again, the deadline is March 31st. Open enrollment won't begin again until November of 2014. So right. There's a gap in there before you can go through open enrollment again.
Right. However, people can sign up for Medicaid all year round.
That's an excellent point.
And also people who may have had what they're calling qualifying events may also apply for health insurance. For example, if you all of a sudden become unemployed halfway through the year, you can go into the health plan finder with the help of someone and you can actually purchase a plan. All
right, very good. Ray White, thank you so much. And if you do want to schedule an appointment, we have two numbers that you can call. They're on your screen, 509-444-3066 or 1-855-487-7686. Ray White, again, thank you so much for your knowledge today. And again, with that looming deadline coming up on March 31st. And that will do it for this show. We are back on April 17th when our topic will be allergies. Timely topic for the time of the year. Until then, thank you for watching. I'm Teresa Lukens. Good night.
Health Matters is made possible by our viewers, the Friends of KSPS, and by Providence Healthcare.
Providence's motto is know me, care for me, ease my way. And Providence does that. I've seen it over and over again. I'm Dr. Stephen Murray, and I chose Providence because I believe in their mission statement. And working together with others of like mind is a very powerful way to take care of patients.
My name is Beth Perez, and I am a registered nurse, and I work at Holy Family Hospital on the labor and delivery unit. I'm about to have my second child, and I chose Providence because I love and trust the people that I work with, and why wouldn't I seek care from people that I love and trust?